bed up. Everything that I need is here. How you doing today, Susie? It's Saturday. Any plans? Do they want you to communicate with your mannequin? I know people think it's a little odd, but a lot of your residents are aphasic. They cannot speak, so get used to that. I've had patients in comas that come out and they knew my name. They came out, so obviously they hear you. Would you mind holding this for me, Miss Susie? Thank you. To the back, like it always goes at the top of their body, and then you want to pull these blankets down underneath them. Just want to get your incontinence pad ready. So the lighter color with the absorbent lines, that's going to be up towards the patient. Just gonna fold that, have it down at the bottom of the bed, ready to go. I'm going to have you bend your knee for me. Take your hand, and then I want you to grab the side rail on the count of 3. I'm going to roll you over. Ready? 1, 2, 3. Grab the side rail for me. Thank you, Susie. You're doing a great job. And then roll back. Come towards me, please. 1, 2, 3. Good job, Susie. Good. You guys can come up here if you want to. And just make like a little window. Trying to keep the person warm as possible. Exposing the areas that need to expose. And so people do their washcloths different ways. So going into the nursing program, they're going to teach you to do the mitts method. That's where you go, like you put the cloth there. You tuck it like this. That's one way you can do it. I don't like it. I don't use it. So I'd show it. I do the 4-corner method. And so whenever I wet my washcloth, I fold it, and then I put like this corner and the corner of my hand like that. And then I put soap on each edge. And then I'll use one part at a time. Then I'll fold that away. And I'll fold up the next one like that. And so you don't want to just go like this, because now all that bacteria is going to all the levels, all the layers. So you just fold one up at a time and go like that, and then fold it away. Fold the next one. That's what I like. I had a nurse aide show me that. You learn the best tricks from a nurse, the experienced nurse aides. They're always teaching me. Nurses, aides. We're always learning, right? That's what it's about. Every day. Learn something new. Sorry. That's not me, Susie, I'm sorry. Sorry. It's a bad day. Bad breakfast. So you want to wring out, before I put the soap on it, wring out all the water, because once you put soap on it, you can't wring it out in your basin. If I had too much water on this, I'd wring it out in my trash can. I don't want to get this soapy. So get it wet, wring it out as best you can, then put your soap on it. All right, Miss Susie, I'm going to go ahead and spread your labia. Okay. So if you're right-handed, I stand on the right side of the patient, so that way I can use my non-dominant hand to hold the catheter, to open the labia. When you do male pericare, you can hold, the penis. Okay, I'm gonna spread your labia. So I'm gonna get inside there, like right through there, and go towards the rectal area. So I'm not washing out here. I'm washing the right inside there, straight down, and then I'll do the other side right through there. And I'm gonna go straight down the middle. So that's why you wanna spread the labia and open them up a little bit. Straight down to the rectal area. And you can let go. People are, can you let go? Yes, you can let go. And on the other side. That'd be different if I was inserting a catheter, I wouldn't be able to let go, but I'm just clean. Go straight on the middle. If you wanna clean the inner thighs out, you can. You don't have to for the state, but just make sure you're working away from the vaginal area. Okay, so you're always working away. You want the basket close enough you're not throwing the washcloth, because then you have bacteria, you know, in the air.
Question. So when do we clean the side part? I don't know what it's called, but
Like the growing area? Or-
yeah, when do we clean that part?
You don't have to.
Oh.
You're just cleaning here, 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 and then you're working your way out.
Oh.
If you want to. If you want to clean out here, you can and use the other two parts of the washcloth.
Okay.
You can. I know in the nursing programs we teach here, here, and then here, here.
Okay.
Alright, and then you're gonna pat dry everything in healthcare, we pat. Pat, pat, pat. Because their skin is so fragile. And just one direction only. So it's not like it's one direction only.
And is there a certain way we're supposed to hold the dry towel or?
No, as long as you're using the clean part every time,
Okay.